Good morning. My name is Alonzo. I am in the youth and infant group, and our project that we have chosen is the Youth Thrive at Home home project. It is a home visiting program with the mission to improve the overall wellness and health of families and their children ages 6 through 12. The project would be focusing on mental health, nutrition, and academic support with home visitors, notably community health workers and social workers. They'll be able to carry out adverse childhood experiences, or ACEs, screening, and will be working with families to connect them and their children to community partners based on the needs of the family and the child, such as providers of varying specialties such as occupational therapy, speech therapy, physical therapy. Additionally, being able to provide connection to families to programs such as the SNAP and WIC programs, food banks that may be beneficial, home agencies, mental health providers, as well as other home visiting providers that are in Wheeler County. Additionally, home visitors that are connected to these families will be able to provide education on parenting skills and child development, as we're looking to establish a good growing base for each child to develop. And so who may benefit from the project? As I mentioned, families and children through the ages of 6 through 12, as we're looking at being able to provide a steady base for growing children to be able to develop. And in terms of who may be harmed from the project, I honestly don't think anyone would be harmed outside of the ages that are not being served, because we are looking to utilize this project as a pilot to start, and then with which additional information from the data that is being collected for this project will then be evaluated, and then we can then return to potentially serve additional ages if this pilot program is successful within the time that we are implementing this program here in Wheeler County. And so let's see here. How will affected stakeholders and communities be involved in the project? And so looking over at our charter, the primary stakeholders obviously would be families and children that are ages 6 through 12 in Wheeler County. Secondary stakeholders include community health workers, mental health specialists, nurses, and case managers who will be serving as the home visitors that are assigned to families here in Wheeler County. Additionally, community partners that home visitors will be connecting families with, such as clinics, SNAP and WIC programs, food banks, home agencies, and other home visiting providers in Wheeler County. Additionally, the sponsoring entity for this program would be the Eastern Oregon Community Care Organization, or Eastern Oregon's version of the Oregon Health Plan, as well as collaboration with the Wheeler County Public Health Department. And additional partners that would be working with this home visiting program would be schools in the nearby area, nearby child welfare agencies, as well as additional community outreach programs that are available in Wheeler County. And so let's see here, and so yeah, with this project we are hoping to provide that support for families, to be able to not only ensure that families' needs are taken care of, but also to ensure that the children's needs, as they are beginning their developmental phase, as they continue to grow, and to be able to connect them with services and supports that will help them thrive, as noted in the 2019 Eastern Oregon Coordinated Care Organization Community Health Plan for Wheeler County. The problem that's been identified here is that early childhood development is critical and foundational in importance for producing healthy and productive individuals, with which adverse childhood effects has been linked to harmful outcomes in adulthood, such as depression, anxiety, substance abuse, and poor physical health overall. a person that has 4 or more types of ACEs are indeed at higher risk for negative outcomes. And so with the home visiting project, with the home visiting program called Youth Thrive at Home, we are hoping to be able to address these concerns by providing that ACE screening and also providing families with the connection to these with these home visitors that are assigned to them, so that we can be able to not only see where each family is, address additional barriers that may be in the way of supports and services, and to be able to get these families connected to supports and services that are needed for not only for the family to thrive, but also for their children to thrive and grow into healthy, productive individuals. And so thank you for your time, and looking forward to your feedback.